Hi, this is Dr. Jonathan Yousef, Networking for Your Optimal Health. Today's topic will be about heartburn and acid reflux. This is a very difficult topic for many of my patients who have tried over-the-counter Tums and Maalox and a few other products like Zantac and Pepcid. And now they're asking what are the medications that they need, forgetting maybe a little bit about what type of diet and weight loss that they can perform. And this topic will broach this discussion about what are some natural ways to improve heartburn and acid reflux, and also touch upon the big discussion about H.Pylori, a bacteria that can cause or lead to heartburn and acid reflux. So I would love for you to join us for another great topic about heartburn and acid reflux. Hi, this is Dr. Jonathan Yousef, Networking for Your Optimal Health. Today's topic will be about heartburn and acid reflux. A lot of my patients complain that they're having a bad taste in their throat. They have difficulty with acidity coming up. They have some upset stomach, and they seem to be very sensitive to certain types of foods, especially spicy foods, hot foods, acidic type foods. And these types of foods tend to cause irritation to their gastric lining, leading to flux. So what does gastroesophageal reflux disease mean, which is otherwise known as Gerd? This is a condition in which the lower part of the esophagus, where the esophageal sphincter is, this is a little bit higher than where your stomach is supposed to close, and it's supposed to have some elasticity. When that elasticity weakens, it allows for acidity to come right back up and cause some problems to the esophagus as well as to the throat. So a lot of my patients complain of some vague symptoms like obviously heartburn, upset stomach, but they can also have a dry cough, and that's because they have GERD or esophageal reflux disease. This is a great time to take a break and recap. Gastroesophageal reflux is characterized by heartburn and acid reflux. You might feel a sour feel in your stomach, and you might even have a sour taste in your throat. So some people have even gone as far as complain of chest pain, and they thought it was their heart, and I think that's where the term heartburn comes from. So if you've been feeling these symptoms, let's talk to your doctor and let's discuss some further treatments. And so in the next little topic, we're going to talk a little bit about what are some of the causes of heartburn and acid reflux and what are some possible treatments. Interesting. So now I get a chance to talk about some of those major factors like weight and diet. And this is probably the two biggest factors that contribute to heartburn. And as you guys know, my other podcasts, I've been talking about how to lose weight and exercise. And this is where I'm going to lead my major discussion on how to prevent acid reflux. So if you are overweight, that stomach is going to be pushing against the abdomen a little bit more and causing the pressure to go back up and leading to that esophagus to build up a little bit extra pressure that it has that should be released. And what ends up happening is that the acidity goes back up. So losing weight is going to be your ideal first step. Secondly, do you want to look at the types of foods that you're eating that are irritating or increasing acidity in your stomach? Those are hot and spicy foods, acidic type foods, foods that when you overeat, so if you're eating a lot of food and you're not taking your time and allowing it to digest, it's building up, worsening the acidity, and then leading to reflux. Oh boy, now we know we can't eat certain types of foods. And I know this is a sour point, no pun intended, for our stomach. And the sourness comes from the fact that we can't have those spicy foods that we all love. And one of my favorites was and is probably going to be those spicy chicken wings. And that's definitely something I'm going to have to consider taking out of my diet. But one of the other things that a lot of people are not aware of is those marinara sauces or those tomato sauces can be a little bit acidic as well. So just to review, we want to take those hot and spicy foods out of our diet if we have heartburn, and then we also want to look at those acidic type foods as well. So there's a lot, and there's a list of them that you can find on the internet, and so let's continue the show. Believe it or not, using a ton of those Tums or antacids will cause the stomach to increase more acidity. So if you're using a lot of those, make sure that you're using them only in a very minute amount or just as needed, because what ends up happening is your body will create more acidity to try to compensate for them. So, just to review, losing weight, eating the right types of foods, and avoiding overeating are the major ways to help with gastroesophageal reflux. So, some of the other little things that you can do is avoid wearing tight clothes, especially around the abdomen area. So, those belts and those really tight shirts or abdominal sort of braces that some people like to wear. I would like to maybe loosen those up a little bit, maybe allow that digestion to occur naturally. Okay, now is the time to check your stomach and see if you've got that belt on too tight or if your clothing might be constricting some of your ability to digest your food. I know that sounds like a minor issue, but believe it or not, that might be a simple, quick solution for your heartburn and acid reflux. The second thing is looking at when you're laying down at the end of the day. Sometimes the reflux can come up a lot easier if you're not at a 45-degree angle or if you don't have a couple of pillows on the back of your head to allow the digestion to go down. I've also recently found out that maybe sleeping on the left side of your body can allow for better digestion. So I'm not quite sure if there's any legitimate research on this particular issue, but I believe that some people like to consider sleeping on the left side. Personally, I have not found any benefit either way, but I also realize that many people have some other underlying causes that maybe can affect it, including genetics. And that's kind of the one thing that I want to lead into, which is sometimes there's just no other choice. You have a genetic predisposition to having heartburn and acid reflux, and we can only affect the things that we can affect, and that's our diet, our weight, the type of clothing that we wear, as well as the tightness of that, the way we sleep, and looking at some of the medications that we would be taking. The proton pump inhibitors, for example, are the major ones that are being used right now because they seem to be the most effective. I have one or two really good ones that I like to prescribe, and of course there's some over-the-counter ones. The problem is they decreased your absorption of certain vitamins, so you need to be careful with that. And they also can interact with other medications. So when you're ready to go on a medication like that, please talk to your doctor and maybe double check and make sure that there isn't any other conflicting medications. One of the things that I like to do is if I do recommend this type of medication, I also run a few other tests. There's a bacteria in the stomach called H.Pylori. This is a bacteria that sometimes can aggravate heartburn and acid reflux. And if we can get rid of this bacteria, sometimes we can nullify or no longer have the heartburn and acid reflux. So if you are having this, besides taking medications, go see your doctor and have your blood test checked for the H.Pylori. So I want to end with one last topic, which is if you're taking medication for a long period of time, let's talk to your doctor about having your esophagus checked out. And that means that I may send you to a gastrointestinal specialist who will perform an endoscopy, because this endoscopy is basically a tube that goes down and it looks for those abnormal cells in the esophagus and in the stomach that maybe can be missed or maybe there. And we want to make sure that if we're not treating you correctly or it's not taking care of the issues, that it doesn't lead to any worsening of your heartburn and maybe even a condition called Barrett's esophagus, an early sign that you may develop esophageal cancer or so. So let me review, and again, I'm excited to have all of our speakers coming up. We have a few doctors that are sort of on the ballot to talk to us about some of these conditions, but I want to end with a few summaries about heartburn and acid reflux. Remember your diet, remember your weight, remember on how you're sleeping, and then when you're taking these medications that are over the counter, please talk to your doctor, because there might be some better ones or ones that need to be evaluated or interact with your other medications. So I've enjoyed doing this podcast. And for those my patients with heartburn acid reflux, please come see us and let us know if you're still taking your medications or if you need us to adjust those or talk to you a little bit more about your diet and exercise routine. This is Dr. Jonathan Yousef, networking for your optimal health. Thank you so much for joining us for another great podcast. This one was about heartburn and acid reflux, and I know that there are a few things that hopefully you guys can take home from and extend your office visit. So once again, if you like our show, give us a good review and also give us any input that you might have to allow us to do a better job in the future. In addition, if you can just subscribe to our channel and listen to us and extend your office visits, this would be a great way to learn a little bit more at the comfort of your own home. So this is Dr. Jonathan Yousef, networking for your optimal health. Hi, did you know that we are right next door to the Lutheran Atonement Church, and the pastor has decided to help us out with our podcast and added a little bit of extra music. I kind of really like the theme music that he added, and I just wanted to thank him for a great job and to also let him know that we appreciate the extra help. And so this is for Mr. Scott Linder, who is our pastor next door, who contributed to the music that you heard on this podcast. Thank you.